Good evening, good afternoon, and good morning. This is the 1868th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Shelly Sharma Bhosale. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English. And from 8:30 to 9:30 to 10:30, the local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends, whether it be a homeopathic lover, a student, or a doctor, whatever it may be. The purpose of the IFBH is to propagate homeopathy among public. And today, let us come to today's guest. As you all know, today our guest is Dr. Shelly Sharma Bhosale. Doctor has completed MD and PhD and has been awarded her PhD degree from Defense Minister of India, Dr. Mr. Rajat Singh in 2023. She has a diploma in IACH Greece and have done advanced courses also. And practicing since 2011, she has successfully treated a wide variety of patients from children to elderly, and she has been also helped to reverse the heal for a variety of illness, including incurable and emergency diseases, cancer, cancer, psychiatry, and many more. She is running 2 clinics independently in Maharashtra and one in Mumbai and the other in Sangli. She is a researcher, and Dr. Shelly has been publishing and presenting her scientific research purpose nationally as well as internationally, Dubai, Germany, Italy, and many more places. Has been publishing research articles in scientific research journals nationally as well as internationally, and was awarded the best case presentation in Liga in 2019. Involved national radio channels to educate people about benefits of homeopathy. She is the ex-associate professor in physiology department, invited as a key speaker in many colleges, conducted educative webinars for students and doctors nationally and internationally, and conducted many health awareness camps, talks, and patients, running independent YouTube, Insta channels to educate patients, people, doctors, and students. And she has presented many papers in this forum, and all the papers were brilliant. And today, doctor is talking about management of pediatric cases with homeopathy. Yes. Doctor, we proudly welcome Dr. Shelly Sharma to this stage. Yes, you can unmute, madam.
Hello, Dr. Dhanesh. Hello,
Yes.
IFPH family. And I'm again very excited to be here. And congratulations for your meet. And I saw the pictures, they were beautiful, right? So today my topic will be, am I audible, Dr. Dhanesh?
Yeah, you are audible.
Okay, fine. So again, one of my favorite topic for today is pediatrics, right? Why pediatrics? Again, I've chosen is because this is one of the biggest challenge we face in our clinical practice, right? Just 1 minute. Yes. Yeah. So pediatric cases are one of the biggest challenges which we face in our clinical practice because there is a lot of confusion regarding pediatrics, right? till today, I see my students, many students asking me, or many patients coming like, doctor, my child is having constipation. Is calcarea carb okay for it? Yeah, for example, my child is having bronchitis. Is antim-tart okay for it? And my child is a crybaby. Should I give Cinna or Chamomilla? So what is happening nowadays is people are not still understanding that pediatric practice is not a very specific practice, and it is very important to address pediatrics correctly. Now, since few years, I have got into mental health. I am looking a lot of psychiatric cases. I'm having very respect about psychiatrists. Number one thing what I've noticed is all your psychiatric illnesses in your adulthood somewhere is rooted in the childhood. Your childhood traumas, childhood suppressions, right? We don't talk about. For example, today children, people at the age of 30, 35 is getting diabetes mellitus, correct? Nowadays, youngsters at the age of 25, 30, 35 is getting myocardial infarction. They're getting, cardiac arrest. Are we addressing the childhood part of those people? How much acutes were suppressed? Are we talking about it? No one is talking about it. We all know that, when you keep on suppressing the acutes, and I think I have spoken in one of my lectures where I spoke about whenever we get an acute, correct? Be it an acute inflammation, bronchitis, whenever your body faces a new kind of bacteria or viruses, the first aim of the body, first line of reaction of the body will be what? It will be your neutrophils, which will come into action. They will fight the infection. So you have an acute reaction. You have cold, cough, respiratory issues, fever, etc. Number one thing. Then what happens? Second stage is inside your body tries to make a memory of it. Okay, we have got this kind of bacteria. We have got this kind of viruses. Let me make let me make it as a permanent memory in my defense mechanism. So whenever I get this infection back, my body will not react so violently. Before my body shows any reaction, the inflammation, the acute infection will be taken care, which is done by the dendritic cells of your immune system. Now, what is happening? You get an infection, you get a viral infection, you get a bacterial infection. Before it is converted into a memory imprint into your immune system, the whole system is suppressed by unwanted antibiotics. First thing in the childhood, right? I'll be going from body to mind. I will be traveling and explaining the benefits of homeopathy from the level of body to mind. Because still we don't understand this subject very clearly. We won't be knowing that what we can offer to the world, what we can offer to the humanity, what can we offer to the collective consciousness, what we can offer to the immune system of the earth, right? So what happens? The moment you take antibiotics, there is an infection. The moment you take antibiotics, your dendritic cells are suppressed. These are research papers, right? They say that your dendritic cells are suppressed. Once your dendritic cells are suppressed, dendritic cells, if I will explain you in a very simple way, they carry the information from acute inflammation to, lifelong memory of your immune system. If your dendritic cells are suppressed, the message will be not carried to your immune system. A lifelong immunity will not be developed. So that is why we see that once a child gets infection, your parent will tell, doctor, my child needs antibiotics every time he falls sick. He needs antibiotics every month. Why, doctor? This is the scientific reason, right? So if you give the correct kind of remedy, I'm not telling homeopathic remedy. If you give the minimum for the child, what are you doing? You're assisting the nature. What is nature? Nature is all about survival of the fittest in the most healthiest way. Nature wants healthy organisms to survive at the level of mind, at the level of emotion, and at the level of body, right? What we are doing is we are trying to suppress. Number second, when a child comes with any condition, be it bronchitis, be it diarrhea, be it autism, I'm treating a lot of autistic children and understanding their needs, understanding their emotions. I have understanding that how important is to understand the underlying emotional state of the child. Why this child fell sick? You cannot fall sick till your immune system is dropped. Your immune system will not drop till there is a disturbance in your emotional state. So a lot of cases I've explained, like for example, a mother, a child who was 8 months old, had diarrhea which was not stopping for 1 month. He was admitted in hospital. There was no change. There was no result in spite of giving best of antibiotics, right? So what happened to the child? They said, okay, you go home, just give him electrolyte powder. We'll see what to do. They came to me. I just asked a direct question to both of the parents, looking at the child. First, I looked at the child. The child was very innocent. The child was very delicate. He was angelic child, with a good eye-to-eye contact. I asked, what happened between you both parents? They said, doctor, nothing. I said, tell me, when your child started with diarrhea, one night before, what happened? Did you both had a fight? And they said, yes, doctor. We had a very major fight where we were telling we will get divorced. So this child is just 8 months, right? We think what can an 8-month child understand? But he could perceive the disharmony between the parents. And then he got the diarrhea. Now, diarrhea is what? One thing is somewhere his immune system got disturbed. The child was on mother's milk. He was not happy with what mother is doing, so he was throwing away the milk. Number one. Number second, indirectly the child wants attention of both the parents. Why? Because if they both are fighting, if the child wants that both parents should be one, I should fall sick. So this is a defense mechanism of the subconscious mind of that person. He was having diarrhea. Number third, the rubric which I took in that case was ailments from discords between the parents. And the remedy I gave was magnesium sulf to the child. So how I got into the magnesium sulf was a child, very cute, angelic, non-violent child. When you look at some faces, you can feel the aura of the person. You can feel the aura through the looks of the child, right? Second thing, we had a very good eye contact. So I needed a remedy who was confident. So pediatric children who have very good eye contact. Think of remedies, sulfur, chocolate, bromium, opium. They are having very good eye contact because they are very confident children. Sulfur is confident child. Phosphorus will have a very good eye contact. Correct? Laccananum will not have a good eye contact. Pulsatilla will not have a good eye contact. So though the child is just 8 months old, but it is a soul which is traveling since so many lives. So the souls speak through the eyes. And in children, you just look into the eyes of the child, he will speak a lot. Which eyes will never lie to you. One more case. Again, I got one more case where the child was having diarrhea since 15 days, not responding to antibiotics. Correct? So I asked the mother, what is happening? The child was 4 months, 5 months old. He was just on mother's milk. The stools were olive green color. So I got one rubric, olive green stools. Okay. Redness of the anus. It was burning. So when I asked the child, mother, what is happening in your house? Tell me, what are you going through? So she said, my sister-in-law is troubling me. She is a very egoistic woman. And because of ego, I'm suffering. I said, how she's troubling you? She is not cooperating with me. She is not behaving properly with me. She's not taking care of my child. I have to take care of her tantrums. She's such an egoistic girl. So what rubric I got was ailments from pride of others. And the remedy I gave to the child was gratiola. So these are the minor things in pediatric cases which you have to take into notice whenever you prescribe such kind of patients. You get autistic children, right? So for autistic children, what you have to do, don't prescribe Barata carb, don't prescribe Cicuta, Buforana, etc. to this child. You will not do the justice for this child. Trust me. For these kind of children, look into the eyes, look into the body language, look, feel the aura of autistic children, feel the aura of mentally retarded children. Get the remedy. And trust me, I've been prescribing this children like remedies like ferrum sulf. These children are doing excellent now after ferrum sulf. I'm prescribing remedies like natrum, opium, not Barata. I think very less children I have given the remedy Barata. How to tackle this kind of children? Go to the mother's pregnancy history. What she has gone through. Because what the mother suffers in her pregnancy, what she has gone through has direct effect on the child. Number one. Number second, understand the aura of the child. Lac caninum children who are autistic will behave very differently. Calcaria sulf children, they will want a lot of importance. Now that's the trick how you have to get the importance out of the child. Right? Somewhere they are very egoistic, they want a lot of importance. Calcaria sulf. Lac caninum, very low confident children. They will not express, they will not ask for anything. They have a specific body language, like they will be flat. They won't have very good physique. Lac caninum children. Correct? Ferrum sulf children. How you will understand ferrum sulf in autistic children? See the child, how it responds to the events happening in the house. For example, one of the autistic child, I gave ferrum sulf. She was not ready to give up anything in life. If she started reading, writing, she was not able to read and write. She kept on practicing it for 3 to 4 days. When the child was building blocks, he was not giving up building the blocks. He kept on doing till he could make it up. So this rubric, which I took, was determination, perseverance. And then I matched other symptoms and I gave the remedy, ferrum sulf. So moral of the story, and here my aim for today's lecture is just to highlight, once again, don't go for shortcuts in pediatric cases. Hahnemann has given a beautiful system of homeopathy. Practicing since 15 years, many of you are senior homeopathic doctors. We all have seen that homeopathy can change lives. And one of the way is treating pediatrics. Because number one, you help with the immune system. Second, if the child's childhood traumas are not healed, not considered, they are the one who can get depression. In adulthood, they will be having a difficult adulthood if the child is not seen, not heard. Correct? So, how to do that? Now the question comes. Now, whenever a pediatric child comes, don't jump towards the remedy. Try to know who the child is. What is the child? How the child is behaving in the clinic. Is the child very active? Is the child dull? Is the child just holding the mother and sitting? Is the child very ambitious? Is the child very career oriented? The child will always show the purest part. We just have to be ready to absorb it. Right? So first you take the chief complaint. In the chief complaint part, try to know who the child is. Try to know what is the expressions of the child when giving the symptoms. Your childhood pediatric case taking starts right the moment the child enters into your cabin. How is the cry? How is the shout? What are the expression of the eyes when the child enters your clinic? When your child enters your cabin, is he directly looking towards you? Is he wanting your attention? Or he just want to be away from you? Just observe it. If the child is high stimulus, he will always do some extra activity, like, he will be very active, he will be dramatic, he will be, do some gestures like actors. You have a rubric, gestures, actors like. I have seen a lot of high stimulus children who come in the and do some acting of some actor. They will wear clothes like Salman Khan or Shah or second thing about higher scammers, what you can understand is when the higher scammers child come, he will directly come towards you. He will have no borders. Higher scammers have no borders because they are shameless children. They don't shy, they don't have any hesitation, they are very direct. They will even get physical with you. They will try to touch you, touch your cheeks, touch your hand, etc. This is how higher scammers child may behave in the clinic. Then, going next, you get the past history of the child, right from the birth, the milestones, surgeries, what traumas the child has gone through physically. Please take a note. Don't do any shortcuts. Number third, know the proper family history. It's very important to know families, mother's family history, father's family history. Are they married in relatives? How is the marriage, etc. Try to know that. Okay. Just mother. How was the pregnancy? Was the pregnancy eventful or it was uneventful? What was the mother's mental state during the child? Most mothers who are suppressed in their pregnancy can have rebellious children. Those mothers who were very rebellious in the pregnancy can have hyperactive children. Correct? Most mothers who are wanting a lot of attention can have hyperactive attention disorder. So I'm just giving a very superficial aspect. I can talk just on family history, pregnancy history for 1 hour. I won't go that deep right now. So what is the need to treat pediatric with classical homeopathy and not just homeopathy? First of all, people think homeopathy is too slow. Homeopathic doctor himself feels homeopathic is very slow. But I'll tell you, homeopathy is not slow, it is very fast. People fear to tackle acutes. Again, if you have a knowledge of acutes, if you have knowledge of physiology, if you have a good knowledge of medicine, if you have good knowledge of pathology, I don't think it is very difficult to tackle acutes whatsoever. Be it bronchitis, leukocytosis, cancer, brain tumors, anything. Next doubt. Can homeopathy be an alternate for antibiotics? For me is yes. It is an excellent alternate to antibiotics. In fact, I would say if we all master how to treat acutes beautifully with homeopathy, if we publish our papers, because in future there is going to be an era where where the antibiotics will no longer be working on people. And this is here the role of homeopathy will emerge for humanity, right? So yes, homeopathy is an excellent alternate for antibiotics, but conditions apply. You take a case properly. Number one, you have a sound knowledge of homeopathic materia medica. You have a sound knowledge of pathology, physiology, etc. And you have a sound clinical knowledge. You can tackle anything beautifully with homeopathy. There is no limitations for it. Should I fear fever? Doctor should not fear fever. If you fear fever, then the pediatric child's mother will definitely fear fever. So once we have to be clear about what is fever. Fever is just the defense mechanism of the body and we should not be suppressing fever. We have to understand whenever we have an infection, your body is going to fight. This is physiology. And homeopathy is a science. It supports body's physiology. It supports nature. So you should never fear fever. Number one. Are specifics better? Not at all. You should take proper case taking, give the correct remedy. You have to do justice with your patients. No combinations. Combination number 33, 36. Don't go into that. Don't go into shortcuts. See, I'll tell you very clearly. We are in an era where you can't survive if you are not a specialized person. Number one, we are in an era we can't survive as a profession till we are not able to offer something to the world which allopathy cannot offer. If we are giving specifics, fever, take califos, take belladonna, take aconite, without taking into consideration the sign and symptoms, we are not doing anything different than what allopathy does. So what is my role? My role is actually beyond what allopathy can do. It is supporting body's physiology. It is not suppressing symptoms. It is helping the body to fight the infection with support of physiology, right? In autistic children, we have to try to reverse autism. Even if we are able to reverse autism by 80%, that's a very big gift you can give to the parent. Even if the child who is coming to you with mental retardation is capable of, understanding himself a bit, can take care of his own things, his belongings. This is the best thing you can give to the person. If the child is having cancer, is going through chemo and radiotherapy, if you give the correct kind of remedy and support the child so that, he will not get the pathology and again, you're offering something very unique. So you have to think in that perspective. Educate yourself, educate others for the sake of homeopathy. Because remember, with homeopathy, we are not treating the disease, but we are treating the process which is happening with the disease. We are treating the miasm, we are treating the tendency, we are treating the immune system, we are treating the deranged vital force, we are treating the pathology. We are reversing the pathology, right? So I will not take much time. I'll start with a case first. This is a case of high-grade fever. The child came with leukocytosis and raised CRP. So this child, when he came to my clinic, his WBC counts were 23,100. So usually when WBC counts are above 1,500, patients are hospitalized. They have given augmentin as an antibiotic intravenous. But this child was tackled with one single dose of remedy. I will tell you how to follow up these kind of cases, but provided only if you are an expert, done well with your subject, you should take such kind of cases, right? Don't play with the patient. So the patient's C-reactive protein was positive. The child was just one. It is not written, I'll see in the case. Okay. So the child, when he came to my clinic, was very restless. Okay. He had high-grade fever, and they are my very old patients. And fortunately, I have a very big support of my patients. I'm blessed to have beautiful patients in my life because they believe in me. They believe in homeopathy. They have surrendered myself to the system of homeopathy. So that gives me a lot of strength to tackle such kind of cases fearlessly, right? So this is a child who came with high-grade fever. The mother said the child is very restless. He hits his younger brother. So he has fever throughout the day. Whenever he doesn't have fever, the child is joking, he's making faces, he's teasing his brother, he's teasing his grandfather. The child does not obey any instructions given by the parents. He just do opposite of what he is asked. For example, mother will say, doctor, if I'll ask him, beta, you have fever, don't have cold water. He will go and have cold water. Or if the mother will say, son, you have fever, you should not sit down, sit on the chair because the pavement is cold. He will sit down. Also, I observed in the clinic, when mother was sitting, beta, don't touch this thing, he will go and touch that. He will deliberately do something which is very opposite to what his mother was telling. So we have to note this thing. This is very strong. Remember, in acutes, you don't need to take much time. I think in just 5 minutes, you can make a prescription. Really, if you're very good with observation, if you're very good with your clinical knowledge, if you're very good with acute case taking, if you're very good with your materia medica, it's just 5 minutes, you can take this case, right? So the child does not obey the instruction given by parents. He just does opposite to what is asked. So whenever I get pediatric cases, no, I just ask my assistant to please note down the symptoms. I keep on observing the child. I keep on seeing his reaction with his mother, with his siblings, how he's behaving, how civic he is in the cabin, how he is outside in the waiting room. Just observe. Just sit and observe. So his mother said he gets angry. Whenever anyone shouts at him, he gets angry, very angry. He will go sit in the corner and he will sulk. He will not talk to anyone for 4 to 5 hours. So he has very bad cough, which is aggravated at night, aggravated on lying down, aggravated by walking rapidly, aggravated in the midnight after 2 to 3 a.m. Now again, whenever you're taking an acute case, make sure you have a detailed chief complaint. You have a proper modalities. Aggravation, amelioration is very important. Time modality is very important. Onset, how the complaint started. This is very important. I have a lot of acute cases to show specifically for pediatrics. But let's see. Now, in the cabin, whenever child is having acute, observe the child. So when the child was walking, he was coughing. So I asked the mother, is it like whenever he's walking, he's getting cough? Mother said, yes. When he's sitting, he's okay. But the moment he lies down and he's walking, he's having cough. I took that into consideration. Again, whenever he was coughing, he was getting a lot of perspiration and a lot of salivation. Noted. The child is restless in the clinic. These were the observations. Salivation when coughing. Patient will hold both the chest when coughing. Again, these were the observations I made. Then you should go and auscultate the child. Right? Auscultate the child. And as soon as I asked the child to lie down, he started coughing. Loudly. And I said, like, come on now, sit. There was no cough. Again, I rechecked, lie down. Was coughing. So make note of these observations. So when the physician has finished writing down the particulars, note what he observes, right? So the observation is not to just see, but look into the case. It is a non-verbal communication between the patient and the doctor, between his emotions and the doctor, between his physical disease and the doctor. Take note of it. So I always tell that, our journey in case taking starts as a detective. You must have seen a lot of detective movies. So what is a detective? He will just go to the crime scene. He will just take note of everything without analyzing. He'll collect all the data. And then he works like a lawyer in the process of analysis and evaluation. And when he is sitting to repertorize the case, he becomes a judge. And he takes certain parameters to reach to the final remedy, right? So after I gave the remedy, so I just would like to show that, just look once again. On 3rd March, patient's WBC counts were 23,100. I just gave him one single dose of the remedy, and on just exactly after 6 days, his WBC came to 11,000. Actually, this child is very rebellious. After giving the remedy, in 3 to 4 days, his fever had subsided completely. He just had cough. So I was very sure my remedy has worked. We also looked into his CRP. That also came back to normal. It is 5.0. Now this is the minimum. This is how your remedy should work if your remedy is correct. Now, again, whenever you are tackling acutes or chronic, homeopaths have a mindset, don't do investigations. But I would say you should please do all the investigations of your patient. In acutes, repeat some investigations after every alternate day, after every 3 days, after every 5 days. In chronic pathology, do your investigations which are needed monthly, quarterly, half yearly, annually. Focus on investigations, be more clinical oriented, because this is what the world wants. You need evidence that yes, our medicine is working. So tell me, what could be the remedy? This was the case. This was the case, right? What remedy do you think of this child? Simple case. It is a very simple case. Any inputs? So I took 4 rubrics, right, for this case. One was the child was very restless. Number 1. Second rubric which I took was contrary. When the mother is saying sit, he will stand. When the mother is saying eat, he will drink. So another rubric which I took for acute was contrary. Third rubric, which was very important for my prescription, was sulky. Whenever anyone is shouting at him, he will just sulk, sit in the corner, not talk to anyone. Number 4, cough aggravated by lying down, cough aggravated by walking rapidly, cough with perspiration. And there was one remedy which I gave him, which is, okay, we just have 4 to 5 minutes left. I gave him Merck Salt 200, 1 dose. And after 2 days, I was having a follow-up with him. And this was the result of the patient, right? So let us talk about some remedies here. I think last time I'd spoken about lac caninum child. I'll not go into that child again. Is everyone aware of lac caninum child personality? Should I be talking about it, Dr. Danish? Or I'll go to some other drug?
Yes, yes, we can go for.
Because if the audience is same, there's no point in repeating the material.
Yes, we can go ahead.
Chalo. So I will not take lac caninum child, materia medica. We'll do another drug. So, whenever what to see in a child, like, check whether the child is timid or bold, whether the child is lovable or non-lovable. So, Calcaria Foss, a very lovable child. You would just like to hug that child. He's so cute, right? You have to note all these things. Yeah, Bromium, very lovable child, very lively child, lot of spark in the eyes. Phosphorus, very lovable child, right? Lac ovinum, very lovable child. Pulsatilla, oh, very lovable child. Chocolate, very lovable child. So when the child comes in, you just have to, yeah, this is a very lovable child. Yeah, this is a very rash child. I don't want to even get close to this child. He's such a destructive child. You get an aura from this children. Observe that all. Fit it into your material. Some children are very timid when they enter into your clinic. They will be very shy. They will be timid. They will not directly come to you like Barata carbonica, like lac caninum. Some children are very lively in your clinic. They are very active. Mother will say, Doctor, my child is so hyperactive that even when he is sick, he wants to go to the school. He is very good in sports. Very lively children. Russ talks is that child. Some children are very bold. They will just come and talk to you like grandparents. They are very bossy children. They will come and sit like an adult in front of you and they will talk to you and they will ask questions with you. They will have conversation. Bold children. Lachesis children initially are timid, but once they have an idea about who this personality is, how is the doctor, they can become very bold. Like a snake, when it comes out of the snake hole, it comes out very silent. He observes everything around. Is there any prey looking at me? Is there any animal who will eat me? He will come out And then once he sees that environment is safe, he will catch a speed. So this is how Lachesis children are. This is how Ophidias are. Phosphoric acid child. When you will look at phosphoric acid, the eyes are frozen. So many children I have prescribed phosphoric acid just looking into the eyes, which are very frozen eyes. Frozen eyes has another story to speak about. Some children are very responsible, like carcinosin. Black caninum children are highly responsible. They are so responsible that they will take care of their younger siblings like a mother. So we skip black caninum children to natrum, to carcinosin. But black caninum are highly, highly, highly responsible, nurturing children. Natrum muraticum, highly responsible. Aurum metallicum. Mother will tell. And how will you understand whether the child is responsible or not? So the mother will say, doctor, my child is such a diligent child. Never throughout my life, I've seen that he will keep his books scattered outside in the room. Once his studies are done, he will fold all the books, keep it into his bags. His drawer is spick and span, very clear. Never I need to tell my child that he needs to do his homework. He will do it. Very good in studies, very neatly dressed, properly dressed, doesn't talk much. He speaks only that much, how much it has to be spoken. They will never speak too much, not too less, because they are aurum. Aurum is gold, very responsible. They know what the capacity is. Tarantulas, never responsible. Lycopodium are responsible, but they are responsible because of fear, because of the timidity, because of being covered. They are responsible. So again, if you see a child responsible, don't stuck there. Look behind. Why this child is responsible? There was a child, I gave him lycopodium. He had leukoderm. So he came neatly dressed, properly collared dress, no funky clothes. Lycopodiums will never wear funky clothes. Properly dressed. Mother said, doctor, he's very responsible. He will do all his homework properly. Here and there, he will never keep his clothes. Exactly, he was looking like a orange child. But then I asked him, how is his nature? My child is little darpok, fearful. I said, like, why? So, but at home, he is dominating us. But when he goes out in the school, very obedient child, always the monitor. So, fear of being shout. The child gets responsible is like a book. But aurum has inborn capacity and trait to be responsible. Aurum will be more responsible towards his work, towards his duty. Cocculus is again very responsible, but Cocculus will be responsible more towards emotional aspect. Why she will be responsible, you know? Because she has cares and worries for her mother. That care makes Cocculus child very responsible. She will take care of her younger siblings. She will take care of herself. She will take care of her grandparents. So I have a Cocculus baby child. So she is just 12 years old. Her grandmother is suffering from cancer. Her mother's entire attention is towards that grandmother. So she sees her mother is constantly working behind the health of that grandmother. Second thing is, she's seeing that her mother is not getting rest, she's not getting proper sleep. So this girl automatically became responsible. Why? Because she has a lot of cares towards her grandmother, towards her mother. That made her responsible. Natrum, she is very responsible. But you have to see what is behind her responsibility. Now, Natrum Mura is responsible. Why? Because she seeks her emotional identity from her parents. She look upon the parents. That makes Natramure very responsible. Calcarea mure, highly responsible children. Correct? Now, Baratas, Barata mure, very responsible children. Now, some children who will come to your clinic would be very introvert. Some children are very extrovert. Okay? Now, sulfurs will be extrovert. Ophidias will be intro-extrovert. Stramonium are extremely extrovert. They will talk everything. High scammers will share all the secrets. I mean, I would say I have a child who is a high scammer's child. He will share his parents' bedroom secrets with everyone. The mother says, doctor, I can't, me and my husband or me and my sister, whenever we are on phone, we can't talk because this child, listen to whatever we are telling. This child is just 5 years old. And he will tell everyone, you know what, my Masi and my mother, they had a fight today. My mother is fighting. My father and mother, they had a fight because my mother took 500 rupees for my father without his information. He will tell everything. He will just relay the information to everyone. That is highest chemistry. Some children are very dominating, like sulflacasis, sulfur, dull camera, nux vomica, highly dominating children. Stramonium, dominating children. Kalis, dominating children. Right? Okay. So, magnesium. These are the children who need a lot of love, security, affection, recognition, and acceptance. So, magnesium children, the essence of the child is, they get disturbed by any kind of discords, like Rutha. They desire harmony. Because once there is a fight, they feel that they will lose the love, the security, the affection, the acceptance of the family. This makes them highly sensitive to discords. Again, you have to understand why this child is sensitive to discords. Magnesium children are non-demanding children. They are having a feeling that they are guests in their own house, like chocolate. Highly, highly, highly. See, we know the literature that magnesium children are orphan children. It's not to be given for orphan children. Trust me, I have been working with an orphan for 7 to 8 years. Just one child. Orphan is not a state, it is a feeling. Any person, be it a woman, a male, a child, if he has an orphan feeling, despite of having the entire family, should think of magnesium. Now, what is the feeling of an orphan? No one belongs to me, I belong to no one. But I need them. Why? For the love, for the security, because I'm dependent on them. I need to be accepted. So, what does an orphan child feel? I can't demand because I am dependent on others. So, magnesium child will never demand anything from his parents. They don't like aggression. They are most sacrificing children. From distance, when you see at magnesium, they look very shy, very weak in studies. But actually, when you see the case of a magnesium child, since childhood, they have gone through a lot of repression. His emotions are repressed and not suppressed. I just want to explain one thing to you about it. So see, I'll tell you one thing. Interesting, very interesting, right? So can you see my screen, Dr. Danish? So this is
Yes,
your...
yes, everything clear.
Yeah, fine. So I'll just give a very beautiful information. So suppose this is your mind. We all know your mind is divided into 3 parts. This is conscious mind, this is subconscious mind, and this is unconscious mind. In Sanskrit, we can call this as, we have three kind of actions happening. I'm just going little deep, but in short, something which is prarabdha, something which is sanchita, and this something which is present karma. Now, prarabdha and sanchita is what? Prarabdha is you're born with certain kind of karmas in this birth. You have to tackle them. This is your that belongs to your subconscious mind. Sanchita is from many births you have collection of karmas. From that ocean of collection of karmas, in this birth you have just taken one pot of karma, came into birth, which is prarabdha. But the collection of karmas from your past lives is called as sanchita. That is our unconscious mind. We don't even know what is there inside it. This life, we may be very aggressive, but you never know. In the past, you were a monk. Or this life, someone is walking in the path of monkhood. Maybe he is maybe, he is an animal from inside, which he is not even aware of. So, coming back to the point, suppose this is your conscious mind. This is your subconscious mind. And this is your unconscious. Till the age of 5 to 8, children don't have a filter between conscious mind and subconscious. So, whatever happens to children till the age of 5, 6 directly gets into the subconscious mind. Till age of 12, maximum till the age of 12. They have no filters. As they grow, 10, 11, 12, they start developing filters. There are 5 filters. So then what happens eventually after 12, all the impression goes through the filters and not every impression goes into the subconscious mind. So we think that pediatric children don't understand. No, they absorb everything through the sponge. They have no filters. Everything will be directly directed towards the subconscious mind, which is known as repression. So, if you want to have very healthy children, good children, never fight in front of your children. Talk good stuff. Your children don't learn what you teach. Your children just follow what you do because it directly filters into their subconscious mind. So childhood history is very, very important. A mother, father may think, okay, we are fighting. He's just 2 months. What does he understand? He absorbs everything. Trust me. Fine. Again, there are things like beta waves, alpha waves, which I won't be talking right now. Fine. So I think we are at the end of session. So this is what I wanted to talk today about.
Yes,
Dr. Danish?
yes, we can conclude and we can have a short discussion.
Yes, before that, I just would like to get into notice about the pediatric one second, Danish. So I spoke to Dr. Danish that very soon I will be taking a small webinar of 4 to 5 lectures only on pediatrics, where I will be teaching remedies like lac ovinum, lac caninum, venus, magnesium, rutas, podophyllum, children, giant mentality. More than 15 remedies I'll be teaching. So if anyone is interested to learn, please, you can contact Dr. Danish. You can message my clinic. My number, I'll put it in the box. Clinic number, you can WhatsApp them. But what the whole agenda of my today's talk was, learn pediatrics the way Hahnemann taught you. Yeah, Dr. Danish, correct?
Yes. Yes, definitely. But we need to follow what Hanuman taught us, and that's what Dr. Uh, Shelly Bhosale has been telling. And definitely, we need to walk in that way. I am inviting Dr. Beatrice to join the discussion.
Yes, thank you very much. It was a very interesting and deep-going presentation, and I was impressed from the first case, the little child with the diarrhea, and you have been asking what happened at home one day before, and they said nothing, nothing. And in the end, it was a big, big struggle. But my question is, I understand the way you were explaining the magnesia part. You, as I understood correctly, you did prescribe magnesia sulfurica. Is that correct?
Magnesium, could you please
Sulfuricum?
repeat? Yes,
Did you
it was
prescribe
magnesium
magnesium
sulfate.
sulfuricum?
Yes, I
Yes.
gave him
So my
magnesium
question is, why did you prescribe magnesia sulfurica and not magnesia phosphorica?
Acha. So for me, number one thing was when I saw the child, he was a very confident child. He had a very good eye contact with me. Phosphorus child will seek affection. If I have to give Mac phos, right? He will be cranky, he will be lamenting, he will be just crying because magnesium phos is a remedy, or a child is always crying big. And when he's crying, he's asking for a lot of pity, like phosphorus, like pulsatilla. He'll be crying, he will be literally lamenting. His cry will be like, my God, what should I do? He's in a lot of emotional pain. But this show him, he had a very eye-to-eye contact. He had a good smile. Second, his soles and palms were warm to touch. He was thermally hot child. His anal region was red. And one more thing, in the past, he had history of suppressed skin eruptions. Parents had applied anti-allergic ointments. He had some skin rashes in the past. So I took some of these symptoms and I gave him magnesium sulfate.
Thank you. Very interesting. Thank you for the explanation.
So exactly what usually when you choose a medicine with the two combination, then we will have to think in that way. That's what kind of direction one need to look into. Uh, that's what Dr. Shelly Bhosale has been explaining. That's a good sign, and that we can move in that way also. Since there is no time, I am inviting Dr. Ambarish sir to say vote of thanks to the session.
Thank you, Dr. Dhanesh ji, and congratulations, Dr. Shelly Sharma. Great session. Very nice session. Describe
Thank you,
the
sir.
pediatric case and body language, emotional, and lot of medicine describe the pediatric. So very, very thanks, Dr. Shelly Sharma. Behalf of IFPH whole team, very, very thanks. Thank you.
Thank you, sir. Thank you, sir.
Thank you, Dr. Shelly Sharma, and those who attend this evening. And tomorrow we will have a session from Dr. Najib, and he will be discussing about the therapeutics of sleep. So we can already 3 presentations are over on that sleep,
Very fast.
and all of you will join us tomorrow at the same time. Thank you all. Good night.